Okay, everybody, I'd like to call the, it's 5 o'clock. It's 5 o'clock. I'd like to call the October meeting of the Albany County Legislature's Health Committee meeting to order. Before we start, Rebecca, can we take a roll call?
Sure, Mr. Chairman. Mr. Joyce?
Present.
Reedy?
Here.
Beston is excused. Mr. Collins?
Here.
McLean Lane is excused. Miller?
Present.
Moriello?
Here.
Ward?
Here.
And Willingham is excused. 6 present, Mr. Chairman.
Thank you, Rebecca. Under, excuse me, previous business, can I get a motion to approve previous meeting minutes?
Second.
Motion made by Mr. Reedy, second by Mr. Ward. All in favor?
Aye.
Opposed. Okay, under current business. Number 2, authorizing agreements with Genoa Healthcare LLC regarding pharmacy services and lease of space at 260 South Pearl Street in the city of Albany. Ms. Hoffman, how are you tonight?
Good, how are you?
Good, thanks. We hope Dr. Giordano's feeling well soon, so.
We appreciate that, I will pass that along.
So the committee's aware of this. We tabled it last month, so we're not going to have you go through the whole motion of what this is about. Does the committee have any questions for Ms. Hoffman or Mr. McLaughlin?
One of the issues that came up last month, and there's been an ongoing discussion, is the non-compete clause in the contract. Will that be removed in the new contract?
My understanding is that it will not need to be. That according, Genoa's belief is that it starts as of the end of the 3-year period, as opposed to the end of the renewal periods. So it will run concurrent with this 2-year renewal period that has been requested. So it will officially end at the end of the 2-year period.
Okay, it'll be out of this new contract.
Yeah, no further
not-
contracts is my
will not
understanding
be-
would contain it.
The contract will run until the end of it.
Okay.
Mr. Moriello?
So therefore, if we do not renew this, then that space remains empty for the next 2 years.
That's correct.
If we do renew this, then the space will be occupied for 2 years, but again, upon completion of that term, then the non-compete expires. And I understand the compliance rate is 88% by having the pharmacy there in-house.
That is that okay if I speak? With your permission, may I speak to that?
Oh, yeah, sure, go ahead.
Yeah, so yes, that is correct. The national standard is about 50%, and since we put the in-house pharmacy in there, it is close to 90%, 88% compliance with our patients, which these are our most ill patients who will end up in hospitals, jails, shelters, et cetera, if they're not stabilized, and we really lose that opportunity to help them to stay on their medication the second they walk out the door of their appointment.
What was the compliance rate, a percentage before the pharmacy was there?
Unfortunately, Genoa is the one that helps us to collect that data in terms of how compliant folks are, but I can tell you that in general, all pharmacies have the national rate close to 50% compliance, so I believe it would probably closely pair with that.
So if we do not renew, then we won't be providing these services to almost 40%.
But we'll be providing the services, we'll have to find others.
No, other ways provided. Yeah.
Correct. Which would most likely go back to our previous rental.
Which was?
We have to have college scripts on the pharmacies. That's right.
Okay.
Well, the clients pick, you can't steer up to it, so. The clients pick which pharmacy they want to use. In our particular case, we're in a unique circumstance, many of our clients have the inability to do so.
And-
But
and-
we won't get into that, this is another extremely complicated
Right.
thing, I've alluded to that, and how much I've been through this, but
So you
we
have
will
another,
revert back to our previous process.
so you have another RFP issued in 2 years.
Correct. Yeah, like any procurement, you'd re-RFP.
Okay, and it's really because of this non-compete that we're in this situation.
I didn't hear that question, Mr. Moriello.
It's really because of the non-compete that we find ourselves in this situation.
Well, the original contract contemplated a 2-year renewal.
I also
So-
just want to be clear, a non-compete for the amount of investment they put in the facility is pretty standard. We wouldn't be able to do this without it.
And I understand that. Genoa invested into making that room.
I mean, I don't want to get into chicken or the egg thing, but the moral story is that without it, there wouldn't be this model of service.
I understand. Okay.
By the way, that goes for anybody that would have wanted to do it.
Okay.
All set?
I'll
No, I have a question. Mike, you
Hold on,
mentioned-
hold on a second, Sean had a
Oh, I'm
question.
sorry, Mr. McLaughlin just addressed my.
Okay, Mr. Miller?
Yep.
Thank you.
So Mike, there was, you talk about we can't steer pharmaceuticals, but there was a letter that was provided to us, through this process on county letterhead, signed by Dr. Giano and stuff, directed to Genoa. So how is that not steering?
So,
Pharmaceuticals.
the letter didn't direct them to Genoa. Genoa opened a pharmacy directly before the largest pandemic in our lifetimes. And at that point, nobody was allowed in our building. Yet we had a service that was initiated for the purpose of better serving our clients. But they weren't coming to the building, they literally didn't know it existed. Now, the letter went out. You can't say the letter didn't go out. We know the letter went out, and we understand the perception of that letter. We were literally letting our clients know of a resource available to them that exists in the county now that they actually weren't aware of. But that is far different than saying, we only call in scripts to whatever your pharmacy is. I understand the perception, I get it.
Yeah, that's what I'm-
And I've said this before, there are a lot of coincidences here that line up, and I understand the frustration. We in no way intended to harm anyone or the business they run. We only intended to improve the services that we provide. And I understand that there are questions, but when this situation was presented to me, Cindy can confirm, so can Dr. Giordano, the county executive said, Mike, dig into this, because if something was done wrong, we have a problem. We reviewed every single case to the point where we went back to the prescribing authority. And rest assured, they do not take kindly to people asking, why are you questioning my medical judgment? And to the person, the decision was made by the individual that is best for them. And I can say that unequivocally.
We actually surveyed all of the patients to ensure that patient choice was employed there.
Are there any other questions from the committee? When we're talking about compliance, the one pharmacy everybody's talking about, I think, and I think at the time it was less than 20% of the actual script load, and so they may have seen like an 80+% compliancy in their pharmacy, and I'm sure they do because they do great work, but only having 20% of that pharmacy scripts that come out of the Department of Mental Health. I think that's the concern of the health committee, is the fact that we want to maintain that 88% and not see that national average of 50%. Not that other pharmacy would see 50%, but they're not the only provider. So, this is it's a tough position we're all in, including the exec's office. But go ahead, Mike.
Just one quick note, as I'll say, is that, when you dig into this stuff, you begin picking up on other things that are kind of tangentially involved. The moral of the story is that the real trend here is everything's going corporate. It's all CVS and larger. That's where the scripts are going, by choice of the patients. And so that was obvious, that the changes are more and more going in that direction. And there's no denying that.
Any other questions, Mike, Mr. Morello?
No, if there are no questions, I'll make a motion to move it out without recommendation.
Without recommendation, we have a motion to move number 2 out without recommendation. Do we have a second? Second by Mr. Reedy. All in favor?
Aye.
Aye. Any opposed? Thank you.
Thank you very much.
Thank you.
Number 3, we have,
I thought it said she's
oh, she coming up, or? Dr. Whalen, you coming?
Sorry. Good evening, everybody.
How are you? Number 3, we have authorizing an agreement with the Centers for Disease Control and Prevention regarding the closing the gap with social determinants of health accelerator plans grant.
So I think this is something that we came here before to discuss applying for, and we did receive an award for $125,000. The grant term is first September 30th to September 29th. Next year, we'll be putting it in our next year's budget. As it says, it's to close the gap with social determinants of health, and this is for targeted programming for areas in Albany County that have highest prevalence of chronic disease and the lowest socioeconomic status. So that would be Albany City, Cohoes, and Waterville. And they'll be utilizing strategies to work with multiple different sectors to ensure that we can, the focuses will be on clinic to community linkages and on the built environment, mainly for transportation.
Any questions from the committee? Hearing none, can we get a motion to move? Motion by Mr. Collins, second by Mr. Miller, all in favor?
Aye.
Any opposed? Unanimous. Number 4, amending resolution number 300 for 2021 regarding COVID-19 funding.
So this is, we received notification from the state about an additional $1 million in grant funding for COVID for the period of 7/1/20 to 3/31/2023. We have been told that this is likely to be extended to December 31st, but we'll come back when we get confirmation of that. This is the ELC funding. A lot of it is work that we're doing with the schools on COVID mitigation strategy. We also received word from the state that this funding can be used for our MPX response, and we still are very active in working with the community on vaccination efforts for both those conditions.
Thank you. Any questions from the committee? Hearing none, can we get a motion to move? Motion by Mr. Miller, second by Mr. Ward, all in favor?
Aye.
Unanimous. Number 5, amending resolution number 391 for 2019 regarding the fiscal year 19 State Homeland Security Program.
And this is a longstanding grant funding that we are requesting permission to extend to an updated grant term to August 31st, 2023. And this will allow for planning activities, public health training. A lot of this is for our public health preparedness staff in conducting drills, making sure the Medical Reserve Corps and the Citizen Corps is ready to respond to activities, conducting trainings, et cetera.
Any questions from the committee? Hearing none, can we get a motion to move?
Motion.
Motion by Mr. Ward, second by Mr. Moriello, all in favor?
Aye.
Any opposed? Unanimous. Okay, at this time, I'd like to, thank you. Oh, you got the next lines. Oh, no? Oh, I'm sorry, it's all mental health. Thank you, Ms. Witherspoon and
Thank
Dr.
you.
Whalen. I should have taken them out of order. I apologize, Ms. Howard.
That's okay.
At this time, I'd like to group, because these are all OASIS-related items, number 6 through number 15. If we can get a motion to group those.
Second.
Motion made by Mr. Miller, second by Mr. Ward, all in favor.
Aye.
Do you want to speak briefly on 6 through 15, all the OASIS-related
Sure,
items?
absolutely. I mean, as we all know, we're in an opiate epidemic, and these services are crucial. And these are just state-funded, no county share, annual renewals for critical services for individuals with active substance use problems. That includes prevention, treatment, and a variety of different recovery-related services, including residential. And they're all different levels of care, and they're really quite vital to the ongoing services for these individuals who really, without that type of service provision, would really not do well, and we would see more fatalities and more substance use-related difficulties.
Thank you, Ms. Hoffman. Do we have any questions?
Just a quick question.
Go ahead, Mr.
How many
Moriello.
people do you think you served?
In our substance use, that, I don't know the answer to that question, but I can get back to you with that
Okay.
information for sure, yeah. It is a really extensive amount of individuals, but I don't know the exact number off the top of my head.
Okay.
I apologize.
Thank you.
Sure. Any other questions from the committee? Hearing none, can we get a motion to approve items 6 through 15?
Motion.
Second.
Motion made by Mr. Collins, second by Mr. Ward, all in favor?
Aye.
Any opposed? Unanimous. Thank you, Mr. Williams. Appendix. Thank you, Wanda. Okay, at this time, I'd like to also group numbers 16 through 25 as all related to the Office of Mental Health Funding. Can we get a motion to group items 16 through 25? Motion made by Mr. Miller, second by Mr. Moriello. All in favor? Any opposed? Something?
Sure. So similarly, these are all state-funded positions. There's no county share. These are annual renewals for services that we have provided for a very long time. As I said, with the opioid epidemic, we are in a behavioral health crisis. We don't have enough services, so we need all the services that we currently have. And these services are really important in terms of keeping individuals out of hospitals, jails, shelters, et cetera. And, you know, there are a range of services ranging from residential, outpatient clinic treatment, as well as case management, prevention, and a variety of other services. And they're critical to the service provision for these individuals.
Thank you. Do we have any questions from the committee? Mr. Miller?
I do, just a general question.
Yeah.
Obviously, this is all pass-through money, I understand that, and
Yes.
there's a lot of mental health issues out there. But with the amount of money that is going through there, are there any reports or anything that goes towards what Frank was asking about?
Absolutely.
For all this stuff, so we
For
can
all
sort of
of them.
see how it's
And I'll,
going?
going back to both the OASIS and the
Yeah.
OMH, because we are regulated by OASIS and OMH for all of these different contracts, there's extensive data and regulatory compliance and site reviews, and all of that is monitored very closely in combination with our department.
Because we know there's a lot of mental health issues out there, but we know there's still
Absolutely.
people suffering that can't seem to get services. That
Yes.
we hear a lot in our, from our constituents, like, I can't even get help. You know, it's so backed up, it's so, filled. So anything that you have that you can share with us would be, you know, at least the
Absolutely.
committee at the very least, so
Absolutely.
see how that's
Yeah,
turning
we
out.
would be happy to share that information with you. And, you know, certainly some of that speaks to issues that we've spoken to you about before in terms of workforce shortages and vacancies. And, you know, we are certainly doing the very best that we can to provide adequate services for the constituents of Albany County. But I don't disagree, more is certainly needed, and there's an incredible amount of need out there.
Thank you.
Do we have any other questions from the committee? No, go ahead, Ms. Willingham.
I'm just looking at the last one here. I just picked this, since they all lumped together. It says authorizing an agreement with St. Anne Institute regarding day treatment and vocational services.
Yes.
So is this by case? Do you know how many people you serve at St. Anne's?
I'm sorry.
Do you know how many people you serve at St. Anne's?
I don't specifically know the exact number, but I can certainly get back to you with that information. That is run through the Department of Children, Youth, and Families, but we do pass through the money to them, and I can certainly get you that information.
Any other questions from the committee? Hearing none, can we get a motion to move items 16 through 25? Motion by Mr. Ward, second by Mr. Reedy, all in favor? Any opposed? Thank you. Thank you again, Ms. Hoffman. Hope Ms. Dr. Giordano's feeling better
I
soon.
will definitely pass that along. Thank you for your time.
Yeah, he couldn't make it tonight, so. Can we get a motion to adjourn? Mr. Mariello, second by Mr. Ward, all in favor? Opposed?
Two, we could do the general.
Without recommendation.